Awesome. Great. So thank you so much, everyone, for joining us. Welcome, welcome. We're so happy to have you all here. I'm just going to do a brief land acknowledgement before we start. I'm coming to you all today from Treaty 13 territory, which is also known as the Dish with One Spoon Wampum Belt Covenant territory. And that represents the shared lands of the Anishinaabe, the Haudenosaunee, the Huron-Wendat, the Mississauga, and the Mississaugas of the Credit First Nation, and now many other First Nation and Métis peoples. Just a little while ago was the anniversary of finding 215 unmarked graves at the former Kamloops Indian Residential School. And so this is something obviously that's really a really sad and heartbreaking experience that we've been having as Canadians. And I think something that we can do, one small piece that we can do as settlers on this land is to look up the 94 calls to action that were made by the Truth and Reconciliation Commission of Canada, and just take a look and see what those say and get yourself familiar with those. And it's one small way that we can decolonize our work. So thank you so much. My name is Emily Ann Opala. I'm the Knowledge and Research Lead here at the Center for Innovation in Campus Mental Health. And I'm so happy to have you all here today. We're going to be talking about social prescribing very soon. But before that, I just want to do a little bit of housekeeping. So the first thing I want to mention is that this is a Zoom webinar. So you can see us, but unfortunately we can't see you. So if you're confused about that, that's happening there. You'll also notice closed captioning happening at the bottom of your screen. If you don't see the closed captioning, you can turn it on by pressing the little arrow on the closed captioning button at the bottom of your screen, or you can turn it off the same way. There's also going to be a chat function that's available at the bottoms of your screens. This is a really excellent place for you all to share your thoughts, share your feelings, share your insights, communicate with one another. And I think a really great place to start today is if you're all interested, I'd love to see what traditional lands you're all coming to us from. So if you want to place that in the chat, I'd love to see that. And if you need a little bit of help with that, you can go to native-land.ca. There's also a Q&A function that you'll notice at the bottom of your screen. So that's what we're going to be using for the question and answer period, which is going to be happening actually in the middle of our session today. So if you have any questions during the time that our presenters are presenting, you can submit them there. Finally, there will be a survey that's released at the end of this webinar, and we ask that you please take 2-3 minutes to fill that out. It doesn't take very long, and it's something that we really do appreciate your feedback on. We really do take a look at these surveys, and so it's really meaningful to us if you take the time to fill it out. So with that, I will now go ahead and introduce our fantastic guests. So we have here with us today, Sonia, Niloufar, Le-Tien, and Caitlin. Welcome, everyone. Over to you, Sonia.
Thanks, Emily. It's a pleasure to be with you virtually. I am Sonia Hsiung. I am the director of the Canadian Institute for Social Prescribing, which is situated within the Canadian Red Cross. And before I jump in, I would like to get your sense of what health means to you. So we are going to put up a Mentimeter. Their link is going to be shared in the chat while you're also sharing where you are from. So if you can just follow that link in the chat and use a couple words or one sentence, just tell us, what does health mean to you? Just give everyone a minute to do that. What do you think about when we say health? Okay, I see some folks in the chat as well. Thank you. Balance of the mind and body, physical and mental wellness, being holistic. Ooh, here comes the fun words. Feeling good, being active, being happy, fairness. I love that. Health is the basis for life. Being rested. We all need more of those these days. being supported, having choices. Absolutely. Vitality, happiness, to love and laugh. Hey, this is wonderful. Thank you so much for that. Well-being, it's great. Where autonomy is great. Being prepared to succeed. This is wonderful. Thank you for sharing this. Thank you, Le-Tien, for doing that for us. I think as Emily's bringing that back up, the slides back up, just from all of you, I think you have a very clear concept that health is much more than medical care. Yet that there are a number, can we go to the next slide just to see a little wheel? There are a number of social, environmental, and structural factors that impact health that you have all identified. And the study by the Health Foundation in the UK in 2018 identified key factors that are particularly important for the 12 to 24 age group. And those are money and resources, living conditions, family, peer and social groups, education, and employment. If we go to the next slide, COVID-19, along with being an acute health crisis, also brought to the foreground the importance of addressing social factors, which I am sure many of you are seeing and identifying in your daily work. This dashboard summary, if you haven't seen it already, is from a series of ongoing studies by the Center for Addiction and Mental Health from May 2020 to January 2022. The surveys are showing an alarming increasing trend of anxiety, loneliness, depression, and binge drinking. All of these indicators were around 18 to 19% last summer, which is already pretty high as a general population-wide survey, but it increased just between summer and January of this year to what you're seeing here, 25%, 24%. On to the next slide. The surveys, once you break them down, also consistently show that Canadians between 18 and 39 years old report the highest level of anxiety, loneliness, and feelings of depression out of any age group that is surveyed. Now, on the slides, you'll see the numbers for loneliness at 29% and depression at almost 28%. And what's not shown is the percentage of anxiety, which is at 33%. So what can we do about this? Over to the next slide. Social prescribing is a way that we can leverage healthcare visits with doctors or allied health providers, counselors, as a doorway to connecting people with non-clinical services that support material needs, mental health, and well-being. Over to the next slide. So here's the key components of a social prescribing model. It looks different when it's implemented in different communities, different regions, from different sectors, but there are some key components. Generally, there's a healthcare provider who sees the client, who notices that there may be non-clinical factors that are impacting their health, who can then refer their patient to a link worker. Right? Sometimes they're called community connectors or navigators or other titles, but their role is to spend time with the patient to help understand what's important to them. What are their circumstances? What are their goals? And then to create the solutions together that is really centered and directed by the patient. I think previously, when you were putting your responses in the Mentimeter, there's a lot of comments around control, autonomy. So that direction, being able to direct their own health, being really important. And the non-medical solutions that are co-created can include a range of things. Supported access to community-based services that may be hobby groups or exercise, access to food, support networks for abuse or caregiving or bereavement, music and dance programs, and a number of other things that's dependent on the person's interest and their need. Next slide, please. Now, the impact of non-medical interventions on a person's overall health and well-being is hard to measure, and we're not used to measuring those kind of indicators. But there are some very promising evidence that's emerging globally. This chart is from a paper on social prescribing outcomes that seeks to identify what is being captured in published research and evaluation reports up to 2020. And you can see text might be a bit small for you, but you can see that there is a wide range of outcomes from physical, like reduced blood pressure, reduced cholesterol, less use of alcohol and drugs, more physical activity, better diet, to spiritual and mental supports, that is improved sense of social connectedness to other people, less loneliness, less anxiety, better coping mechanisms, feeling more informed about their health. And I also want to point out specifically sense of control and hope for the future. And we know that those are significant protective factors for people. Over to the next slide. So social prescribing is now a global movement, and there are a number of Canadian initiatives around that. So at least 20 countries worldwide are engaged in social prescribing in different areas. So there are some in primary care, there's some using secondary and rehabilitation and acute care, home care, and as well, of course, community sectors. In Canada, the innovations are being led by different organizations across different provinces. So there's community-based organizations such as United Way BC and Ontario 211, Canadian Red Cross over in the eastern provinces. There are regional health authorities like Island Health and Newfoundland and Labrador that are engaged in social prescribing. There are primary healthcare teams like community health centers in Ontario. There are some acute care partners, and there are many others that may be using slightly different terminology, but are very similar in approach and in principles. Despite the number of initiatives that's happening, there's currently no systems level investment in social prescribing in Canada. So if we move on to the next and final slide, this leads us to the Canadian Institute for Social Prescribing, which I lead. It's a new national hub that's aimed at bringing together people to foster, share, and celebrate practices that are connecting people between healthcare and the non-clinical interventions that are supporting holistic well-being rooted in the social determinants of health. So it will be a focal point for social prescribing in Canada, and it's grounded in a commitment to equity, community leadership, and collaboration. So if you would like to follow us, to learn more, to share, just to be connected, there's our website. You can also follow us on Twitter. I think over back to you, Emily.
Excellent. Thank you so much for that, Sonia. That was excellent. That was a great review of social prescribing. So now I'm going to turn it over to the Canadian Social Prescribing Student Collective, who's going to tell us a little bit about their work.
Awesome. Thanks so much, Le-Tien. So I'll start us off just by kind of talking a little bit about who we are. So my name is Caitlin Muhl. I'm a PhD candidate at Queen's University, and my research is focused on social prescribing.
Hi there, sorry about that, couldn't find my mute button. My name is Le-Tien. I am a PhD student at McMaster University, studying social prescribing, obviously, as well.
Hi everyone, good morning or afternoon. My name is Niloufar Aran, and I am getting my Master of Science degree at Simon Fraser University here in BC, and my work is focused on mental health and social isolation.
So just a bit about who we are to begin with. So we're the Canadian Social Prescribing Student Collective, and we're a group of students who are passionate about social prescribing. We launched around the same time that the Canadian Institute for Social Prescribing launched. So that was just a few months ago, and we're quickly growing. What started with just 3 of us in 2 different provinces has grown to over 70 members across 5 provinces on Turtle Island. Our members include undergraduate students, graduate students, doctoral students, health professional students. And they study a variety of things spanning from public health to psychology to business admin, and so on and so forth. We strive to demonstrate the values of social prescribing in our work. We're working towards horizontal leadership, ensuring that all of our members are involved in all of our large decisions. And we all work together to build a social prescribing student movement across Canada. We've done quite a bit of work so far in the past few months from developing working groups and creating partnerships with community organizations across the country. And all of our work demonstrates 4 underlying values. First, we aim to collaborate across provinces, sectors, and fields. We're working towards educating people, whether they be students, community members, or professionals about social prescribing. We are advocating for best practices and the advancements of social prescribing. And finally, what I think is the most important, we're hoping to innovate in the field of social prescribing because we recognize that Canada is at a unique point where potential for innovation is huge. And we hope to capitalize on all these opportunities to not only advance social prescribing in Canada, but internationally as well.
So in terms of what we've accomplished to date, we started off by using the Social Prescribing International Student Movement Framework and really kind of used this as a guide to establish our group, which was really helpful. And then after that, something that we did was also join the Global Social Prescribing Student Council. So because of the framework, there's actually been a lot of countries where students have decided that they're going to kind of create these student groups to build the student movement. And so we've joined other countries like Australia, UK, Japan, to build this council so that we can network and sort of grow this movement together around the world. We've also created a Twitter account, so we're going to promote that today so that all of you follow it if you'd like to. We have, I think it's 276 followers now, and have had over 29,000 profile visits in just the few short months that we've existed. So we're pretty proud of our account and how it's grown. We've also, like Le-Tien said, created our mission and values so that we can really kind of build ourselves on a strong foundation. And we've also been invited to participate in webinars like this one. And Le-Tien was just recently at the Australian Social Prescribing Student Collective webinar. So lots of great opportunities. We've also had some great discussions. So this includes conversations with arts and culture organizations across the country who have been really excited and eager to collaborate with us and see how they can support us and how we as students can support them. So that's been really exciting. And we've also had conversations with academic partners who've reached out to us and said the same thing. They want to see how we can try and create some sort of collaboration, which is really great. Another thing is conversations around curriculum. So this is something we kind of as a group feel very strongly about, that if we kind of want to embed this into the Canadian system, that we need to really target curriculum so that students are learning this in school and going out into the workforce, having a good understanding and appreciation of what social prescribing is. And we've also established working groups. So like Le-Tien mentioned, we've grown quite quickly and it's been pleasantly surprising to see how fast we've grown. And so we've sort of created these different groups to tackle different issues. And so we have a research, policy, practice, and knowledge translation working group. And we also have university chapters that have started. I believe they're in 3 different provinces. We have 5 different universities right now, and we anticipate that that will grow. And finally, something that's very relevant to you today is we've started conversations around the use of social prescribing on campus. And so we'll talk a little bit more about that on the next slide. Awesome. So I can start off just talking a little bit about the project I'm looking at. So this is a university in Ontario, and they're looking at the idea of taking an undergraduate student and actually having them kind of roll this out and have this happen in their university setting. By doing this as part of their research for course credit, which I think is an excellent idea. So the student will be able to dedicate the time that's needed to make this happen. And the idea is potentially to think about the idea of having students on campus act as the link workers, so to take on that role, which I think is really great because it's kind of that for students, by students sort of idea. So very preliminary conversations with this university, but I'm very excited about this one. And I'll pass it off to Le-Tien now to talk about the other one.
Thanks, Caitlin. So another university in Ontario that we've been talking with is thinking about trying to implement social prescription in a slightly different way. As Sonia mentioned in the beginning, social prescribing looks very different depending on the context in which it's implemented. So in this university, they want to take advantage of resources that are already existing. So they want to train dons, and this is in one particular residence. They want to train dons to be the link workers. And they saw the value in that because dons already play a very similar role in their day-to-day work. It's just with social prescribing, there is this added facet of data collection and also follow-up, which is very important to ensure that what you're doing is working. And so they're currently trying to work on developing a framework to train incoming dons on how, first of all, what needs to be addressed specifically. So for example, they're looking at one issue, which is domestic violence on campuses. And so they're training link workers dons on how to identify signs of that and which resources are available to their students to address that. And they're also trying to figure out the finer details and logistics of how do you follow up with students in a sensitive and respectful way. But this is also very much in the early stages, and it will likely grow and expand to something that looks maybe like a more traditional social prescribing scheme in the future. Oops.
Thanks. And so at our last general meeting that we had last week, we asked our wonderful members of the student collective some of the same questions. So why social prescription might be important and why it might be important on campus. And this is what our members wanted you to know and wanted us to share with you. So, I think there was one slide before this, or maybe.
Sorry, one second. There you go.
Awesome. So some common issues that the students identified that could be addressed through social prescription on campus are things such as social isolation and loneliness, stress that a lot of students go through, such as finances, discrimination, and so on. And they also recognize the lack of exercise and time in nature. The students also said it would be great to offer social prescribing on campus because it would allow for easy access because students, as I'm sure you know, are always on campus anyways. As well, they recognize that there are many resources both on and off campus that can be prescribed through social prescription. And these include community health organizations, employment assistance programs, social support groups, housing, and etc. As well, so we also asked them how they thought that students could contribute to the implementation of social prescription on campus. And what Caitlin and Le-Tien already talked about were things that our members also highlighted. So they talked about volunteering to be link workers and to be providers of social prescription. So having like a student buddy or taking students on walks. They also mentioned advocating for the use of funds that students already get. So to implement social prescribing work on campus. They also were passionate about providing social prescription training and creating student champions to establish social prescription clubs and to promote that on campus, and as well connecting with professors and folks who are already doing this type of work to champion social prescription projects and evaluation on campuses. Thank you.
Thank you so much, and we'll pass it back to Emily.
Excellent. Thank you so much for that. That was an excellent overview of the things that you guys do, which is so much. Thank you for that. So that's the first sort of half of our webinar today. And the second half is going to be really interesting. So we have, first, we're going to do a little bit of a Q&A session. So this is your opportunity to drop some questions into the Q&A box and ask away anything that you might be wondering about social prescription. I'm sure that there are many questions because this is obviously something very new. And then after that, we're going to go into a little bit of an activity with a Google Jamboard. So it looks like we've got our first question. So I believe that this question is for the student collective. What components would be included in your training?
Yeah, that's a great question. I'll jump on that. We did speak about that briefly with our members. What's great is that there are tons of resources, free resources out there already. For example, the World Health Organization, I believe, has a social prescribing link worker training that is already available. But of course, as campuses go forward with this, there would be unique trainings for each campus to know what resources are available on campus. And of course, there's always that issue of confidentiality that must be considered when we have students working with students around sensitive issues. But we would likely base our trainings off of what has been provided already through the World Health Organization.
Great. That's great. Looks like we have another question that's popped into the chat here. How is this different from work of peer health educators and mentors, health promotion programs that are already in place? I think that's a really great question. Does anybody want to take that on?
I can take on first. So that is a really great question. I think it's not necessarily different, but it's building a pathway from healthcare. So I think there are a number of programs that address health in those ways, but they're not necessarily connected. So people either go to a healthcare medical appointment or they seek out these additional resources, but those are not necessarily connected in that kind of way where people have support to access and are referred. The other piece, I think, is the data tracking. So within the social prescribing pathway, it's around following a person's journey throughout the different areas and understanding the impact of these different interventions on their health. So those are kind of some key pieces. And of course, the other piece is, which a lot of health promotion practices do emphasize, is the person having choice and control, and is a part of that co-creative dialogue of what health looks like for them.
Thank you for that, Sonia. Would anyone from the student collective want to add anything to that?
I think what Sonia, she perfectly explained it really. I think what's important to mention is social prescribing isn't this exactly this brand new idea that's just, brand new. Nobody's ever thought of this before. There is some really great work going on out there that is very similar and is doing very similar stuff. And I think about community health centers, which were part of Ontario's first pilot, right? They already have that sort of model going on. But really what this does is sort of strengthen and deepen that work by creating that tracking and the feedback loop to really know, is this making a difference and an impact on that person's health and well-being? So
that was so well put.
Building up to add to Caitlin's point, building a formalized structure around work that many of you probably already do in your everyday.
Fabulous. Yeah. Do we have any other questions for our panelists? I'm going to give folks just a little bit. Oh, we have another one that's popped in here. Any suggestions for introducing social prescribing to student affairs practitioners who may be unfamiliar with it? What considerations would support in developing a structure? It's a great question.
I think we've been starting to have conversations with this with some schools, but I think what our student collective and what the universities we're working with are really passionate about is this core tenet in social prescribing that services should be co-produced. And so this idea of, for someone who's unfamiliar with it, of course, there are resources that exist here in Canada with CIS, but of course with us, we're always happy to talk more about it, to learn more about what social prescribing has looked like in the past. But of course it can look different in where you're working. But the considerations that would support is working with students to understand what are students' needs, and also working with other services across campus. I think campuses are excellent places for social prescribing because there are just so many resources that exist on campus that are all working independently and don't really connect with each other. And in doing so, we have quite a lot of repetition, and there's also just students who go through 4 years of undergrad or more, never knowing that these resources exist. So I think that would be a great first step to understand what resources exist on your campus and what do your students need from this.
I think I might also add to that, if you're looking for sort of a bit of like how do I actually do this here? I was supporting a community health center to do this in Ontario, and we heavily drew from the Alliance for Healthier Communities Social Prescribing Guidebook. So we absolutely love that and found it was really helpful to kind of guide us in how do we actually do this, right? How do we implement this? What does this look like? So I can put that in the chat if that's helpful for anybody.
That's great. Thank you, Caitlin. Anybody have anything else to add? Okay. We've got some more things coming in through the chat. So Joanne here has asked, we have difficulty involving youth in our social rec programs compared to adults. Why is that? That's a very good question, Joanne. I'm wondering if anybody here has any insights into that.
I just want to clarify, social rec as in social recreational programs?
Yeah, that's a really good question, Joanne. If you could clarify what you mean by social rec, that would be really helpful. I think in general, this is something that we're seeing a lot at CICMH. We're hearing a lot about people who are struggling to involve youth in that. Yes, so Joanne was talking about social recreational programs.
I think so. For the reasons why youth are not as involved, I'm not quite sure about the specifics, but one thing that I think that's great about social prescribing and how it's been implemented elsewhere is that role of the link worker and how involved the link worker is with the client. So something, for example, in universities, especially loneliness, it takes quite a bit to have the courage to go to an event alone. And so what link workers have done in other iterations is that they go with the client to these events to ensure that there's support, there's also accountability to help make sure the client does go to the event. And that's one way that this has succeeded in the UK and where it's been implemented. So that could be a factor to address why youth aren't going to these things. But I am no expert on like the wider issues that are underlying this.
I think that was a great answer, Le-Tien. Thank you for that. I think it's a tough question, right? Because it's a very specific context, obviously. But hopefully that was helpful to Joanne. We have another question here that's a little bit more of an involved question. So I'm going to read this out to you folks. So the profession of therapeutic recreation exists within different capacities throughout Canada, and within the practice model is community integration and utilizing community resources for people's very individual health needs. There's a number of professional competencies required which vary across the country. How would you manage the risk associated with sensitive situations where people are prescribed inappropriate services?
Yeah, so let me take a stab at that. And also, I think that a couple of the other questions are very similar in vein. in terms of how to ensure that practitioners is aware of safe places to prescribe and motivational. So I think just to circle back on the previous question around motivations, I think part of the focus of social prescribing is that co-creation, right? So it's called prescribing, but it's not like you should exercise, here's the exercise program, go to it, right? But it's around like, what are people interested in? What are their gifts? Maybe it's not exercise, but maybe they love dance, right? But those are the things that's going to emerge in that conversation. Maybe it's not dance, but maybe they love walking in nature and they would do better with a group of people, for example. So anyways, I think those are some of the intricacies around that. The thing around who can be a link worker, what are the qualifications of a link worker is a really good question. And I think that's something that we are building globally. So in the UK, they have specific training that they've put out for the link worker. And these link workers are either supervised by the community or by the health authority, so that there is some quality assurance around what are people prescribing. And there's a lot of effort. If you look at all of the guides that's been put in the chat, there's a heavy emphasis on asset mapping, right? Understanding what is the asset in the community, who are they suitable for, who are they geared towards, what are the training of the people providing these type of programs and services. So there is that pre-work that does need to happen, and also then emphasizing that role of the link worker, because we realize often prescribers may not be the person who has the time or has the expertise. It could be the recreation therapist that's attached. It could be the health promoter or the educator, whoever that might be that is most suitable for that role, who then understands the assets. And then we follow up, right? So there is that follow-up process of how did that work? Was it appropriate? Was it what meeting the intended goals? And if not, how do we iteratively improve on that and journey with the person? So I think that is all part of that pathway, which is why there is support that is required to build that framework so that it is appropriate and impactful for the person.
So well answered. Thank you for that, Sonia. So we have one more question, and I think we'll stick to this question, and then we'll move on to our activity. The question is, we're implementing social prescribing with trans youth. The challenge is ensuring the practitioner is aware of safe places to prescribe and connect with. Practitioners need to make sure you know the approaches, inclusivity, etc., of the social prescription. So trauma-informed social prescribing. Curious about the panelists' thoughts on this. So a little bit confusing, but I think generally what this person is asking about is what we think about this idea of trauma-informed social prescribing specifically, and how that fits into the social prescribing model.
Yeah, absolutely. I think if we look at the Alliance resource in particular, there is a heavy emphasis on equity, because it is specifically around supporting vulnerable people who are already experiencing harms and barriers to access in the system to access. Maybe social prescribing is not necessarily for people who will access the services by themselves. We need the supported pathway and leveraging healthcare as a doorway, because to catch those people who will not access these services themselves or may not know how or where to access their services that are appropriate. So I think that's absolutely a foundational to the to social prescribing, and is part of the training, or should be part of the training of the prescriber, the link worker, and the community supports that are being prescribed.
Thanks for that, Sonia. Any additions from the student collective?
I just wanted to circle back and say that actually sort of answers the other question, talking about uptake in youth. So if we find that these services are effective, and if they're like culturally competent and aware and everything, that way we can make sure that youth are using their autonomy to choose. And I think that's also a really important component of involving youth. So I think that it sort of circles back there, and the whole follow-up is really important part of social prescription to make sure that everything is working like it should be.
Right. That makes a lot of sense. Okay, so I see that some more questions are coming in through the chat, but we are going to be moving forward now. So what we're going to be doing now is a little bit of an activity where we're going to be mapping out some ideas together. So if you'll all give me just a second, I will get the link to this Jamboard for you all. Copy that link and put that in the chat here. Okay, so everyone should be able to access this Jamboard, and I'll go ahead and share my screen so we can all sort of see what that looks like. So here we go. Oh, first I'll need to close that. Okay, and then we can do that. Okay. Okay. So folks should be able to see that. So there are 3 pages here that you'll notice, and each one has a different question. So the idea here that I'd love for you all to do is to move over to the left-hand side here of your screen, and you'll see that there is a sticky note button right here, right under the cursor. If you click on that sticky note, you'll see this come up, and you can enter any kind of text here. So you can answer the question here and then place your sticky note anywhere on this page. So the question for you all to answer, the prompt for you all for the beginning of this exercise is, what social issues do you encounter during students' health appointments? So I'm going to give folks a little bit of time to submit that there. And this could also be, you know, for counselors, what kind of social issues are coming up in counseling appointments as well.
If you want to type it in the chat, I think we would also be happy to help transcribe them so that we can all
for
see.
sure. Thank you. Okay, we're starting to get some things here. So we have isolation, definitely. Food insecurity. Yeah, that's a big one that comes up a lot, I think. Interesting with language here. I'm curious to know more about that. I wonder if people could, looks like loneliness is coming up a lot for sure. I'm also seeing here substance use, homesickness, housing insecurity as well. Racism, yeah. Anxiety. General stress, feelings of being overwhelmed, discrimination. Not being in a group, interesting. Perfectionism. That's a really good one. Yeah, mental health, definitely. Not knowing where or who to turn to. That's a great one. Disability.
That's a key one around social prescribing, the connecting people, because there are a lot of services, and Le-Tien and Caitlin Muhl have all referred to there being an overwhelming number maybe of services that's available on campus. But it's hard to navigate, especially if you're already facing barriers of racism and discrimination or feeling lonely and like don't belong. It's hard to seek those out on your own.
Absolutely. We also have invisible disabilities that's coming up too. Impact of past traumas. So all of these are feeling, I think, like items that definitely could be addressed by a social prescription. Would that be safe to say, Sonia?
Yeah, I would agree.
Yeah. Awesome. So this one's starting to slow down a little bit. I'm just going to give people another minute to submit anything they want to around social issues. Fear of reaching out. Interesting. Stress. Trust. Ooh, yeah. Lack of service providers understanding culture /BA, which I'm not sure what that refers to.
I think the trust thing is such a huge part of social prescribing, because there's a lot of distrust, especially this is all just a throwback for me back to undergrad years. A lot of people who don't trust the health services on campus just because of, I'm sure health services overwhelmed. I've had the unique opportunity of being on both ends, so seeing the background of how health services works and being a patient, and the trust thing is so vital. And I remember it being a really contentious point in my undergrad years, and that's where social prescribing, and I know this is the whole point of being a peer health educator, or why those services exist. There's this understanding already. Students, and the idea of students helping students is so important, because there's already these feelings of distrust that exist. So with the link worker, ideally, whoever it may end up being is hopefully going to be in a position who is more equal level to whoever the student, the client, whoever it may be, who can actually help them navigate these systems together, as opposed to traditional prescriptions where you write it and then send them off. So I think trust is such a huge point here, especially for students.
Mm-hmm. This looks fantastic. This looks great. Thank you to everybody who submitted pieces to this question, because I think this is a very fulsome look at sort of what kinds of things we might be thinking about when we're talking about social prescription. So I'm going to move on to the next page here with the second question. So our second question, our second prompt for you all is, what are the social prescriptions that you and students have access to on campus? So this is a little bit of a harder question. This is asking you to think a little bit more about what actually exists and what kind of things you do have access to. Elders and cultural support. Yeah, that's a great one. Counseling, of course. It's a great one. Campus recreation, for sure. Clubs, for sure, yes. I can definitely see, clubs being a big part of social prescription on campus. Food bank and pantry, absolutely. On-site nurse once a week. Ooh, walking groups, yeah. Prescription exercise program. I don't know if I already read this one, but Indigenous groups and spaces, that's good. What are some other things that that you have access to? Game nights, I love that. LGBTQ plus group. Cultural and religious groups. Ooh, volunteer opportunities.
I love the volunteer opportunities, and also the you see from the student collective how eager the students are to volunteer. One of the findings out of social prescribing is that when people are invited to co-create the solutions and also lead those solutions for others, that's where we're seeing the most change in their sense of confidence, sense of renewed purpose, sense of self-advocacy, more so than the people who are participating in the groups. And so in the UK, there's a lot of the prescriptions is around volunteering.
Interesting. Very interesting. We've got some more really good ones here. We've got co-created mental health pilot project, iSparrow, which I'm not sure what that is, self-guided care module. That sounds like a really interesting resource. ADHD support group. Yeah, support groups I see being a big piece of that for sure. And of course, regular wellness student check-ins. Yeah, these are great. So it looks like there's a lot of different things that are available to folks on campus. And I think that's one of the beauties of a college or university campus, is that there's all of this available resources that exist in this, this sort of community that exists. Drop-in supports as well. Yeah, fantastic. I'll give people maybe one more minute to put some more things on here. And after this, I'm going to leave this up. This Jamboard is still going to exist. So you'll all have the link to it and you'll be able to access it later if you're interested in brainstorming a little bit more around social prescribing on your own campus. I also see here daily continental breakfast and hot lunch at no cost. Yeah, absolutely.
Sorry, what school is this? Can I go back to this? It definitely was not on my campus.
No, me neither. I definitely didn't have access to that. That is a really cool thing to have access to, for sure.
I love it. Food is such a good way to bring people together and to make those bridges.
For sure.
It's wonderful.
I think
Your
I
mentors
also,
for international students. Yeah.
oh, sorry. I think I'd just like to add that there are so many services here, and then like I guarantee there are double, if not triple, amount of services that exist on campus that do not that are not here yet, because there's just too many that we can't really expect an individual to know. For example, I think in a study in the UK, who has just released an evaluation on one of post-secondary campuses, job boards, your career support center is also a great social prescription destination. And I know that's a huge issue for some students as well, especially close to graduating.
Yeah, for sure. That's great. Okay, we're going to move on to the third and final prompt. And it looks like somebody's already come in here and put Caitlin's name on here. So who can you partner with on campus to learn about social prescriptions or to refer students? Is our final question.
I would second the student collective prompt.
Yeah.
I think the student collective is going to be a really wonderful, not just resource, but help in supporting you to do this work on campus.
For sure. So we've got health promotion, campus recreation, student life. Yeah, for sure. Enactus, I'm not sure what that is exactly, but sounds interesting. Human rights and equity, great one. Oh, professors who know about and promote social prescription, yeah. Great one. Outreach center, student health services, student services. Yeah. Counseling, of course, a very classic one. Social innovation hub, oh yeah, for sure. Student accommodations, career services. The library, yes. Love that, love the use of the library. Academic advisors.
I also encourage you to think about who might be the key partner, key ally, who would be able to link all of these components so that someone is not navigating, campus recreation and then the separate health promotion department and then library, they offer separate things. Who's going to be the linchpin on your campus?
Yeah, Great question. We'll give folks maybe just one more minute to pop that in. Yeah, student ambassadors. University administrators, yeah. This looks great. Looks like there's lots of sort of opportunities here for collaboration, which is a beautiful thing. Awesome. Okay, great. So that's it for our little exercise here. So I'm gonna stop sharing for now. You all still have access to that, so you can still add things if you'd like. But I'm gonna turn it over, I believe, to Le-Tien, who's gonna do, is it Le-Tien who's got the final slide?
Yep. So we just have one more Mentimeter, 1 second, that we'd like to share, and it's just for everybody to brainstorm what can we do after this to really get started on bringing social prescription to campuses. Now, 1 second. And I will put the link in the chat again in case that's lost or because that's lost. But yeah, so how will you use what you've learned or heard about today? What actions, if any, do you plan to take? And I've just put the link in the chat.
Very curious to hear what we're going to see here. Read the resources you shared. Excellent. Lots of cool stuff here.
The Student Collective would be super happy to connect with any campuses who may be interested. We have quite a few students who are really eager to do some hands-on work.
Excellent. Looks like a lot of people are going to be sharing information about social prescribing with people that they know, which is great. Great to hear. And just for all of you to know, this webinar today was recorded, and so it's going to be available on our website if ever you'd like to refer somebody else to take a look at it, just to let them know a little bit about what social prescribing is. That's something that you'll have access to as well. All right. Well, that brings us to 2 o'clock. So I'm going to close this up for the day. Thank you all so much for the excellent presentations. Thank you to Sonia, Niloufar, and Le-Tien and Caitlin. Really an excellent presentation today. And thank you so much to all of our really fantastic attendees who brought so many interesting insights into our question period and to our activity. So thank you all so much for joining us. I also want to remind you all that our next webinar is actually going to be in September. So we're taking a break for the summer months, but you can catch our webinar on compassionate data collection on September 22nd. Thank you all so much, and please don't forget to do the survey. Take care, everyone.